I'm Barkha Dutt. You're with the Mojo Story. The world has only one word on its mind, and it's called Omicron. And there is one doctor to which the world owes a debt. Today, we'll be meeting the South African doctor who first revealed Omicron to the world. Let's take you through what we know thus far. Now, we do know that in India, there have been 2 Omicron cases, but like everywhere else in the world, we are coming to terms with the fact that this variant may not have even originated in South Africa. It is already in community transmission in several parts of the world. The good news is that while the risk of reinfection seems to be high, the symptoms reported globally from South Africa to the United States of America are mild. And so far, there has not been any mortality linked to Omicron. South Africa has protested ferociously the ban on people coming from its country, and that has been upheld by the fact that so many cases are now being found globally that were not even linked to travel. In any case, travel bans are yesteryear, and we're going to be meeting the doctor who first revealed Omicron to the world. We owe her a debt, and instead her country has been penalized and punished in what many, including me, would call travel apartheid. It is a kind of racism. I'm very pleased to welcome to the program Dr. Angelique Coetzee. Thank you, ma'am. And like I said, we owe you all our gratitude for the transparency, for your service, and for your work. But have you been hurt, angry, startled? I'll come to Omicron in a moment, but first I just want to understand what you've been going through emotionally since you revealed Omicron to the world, and just unmute yourself before you respond. Yeah.
Thank you so much for asking that question. There's 2 answers. The first one is that morning when I first saw the first case, and I realized, when this, I think the patient could have seen the shock on my face because I did a rapid test on him. And the first thing.
So you detected Omicron in a rapid antigen test, not even in an RT-PCR.
Yes,
wow.
In a rapid test. And it went through my mind, please, not again. This, we knew it was going to happen, but we thought it would be end of December, beginning of January. And then we're going to go through this again. And it's terrible, that feeling of angst that go through you, and as I said, not again. And then, when as you all know, I alerted the authorities, and simultaneously in the background, some of the labs, Lancet, actually on their PCR, saw tests that they were doing from other patients, also saw that there was something wrong with there was a loss of a gene, the S gene. So, and they also alerted and said what's going on. And then last week the diagnoses were made, or the world was being told about this new variant. So what then, I think the second thing that is traumatic that's not traumatic to me only, but to the rest of my country, that's within 24 hours, actually less than 24 hours, after our scientists said, look, there's a new kid on the block. We don't know what is going to happen. We don't know what it means. Britain was the first country to just slam us with this travel ban. And now what is extremely hurtful in that is South Africa's got a very good relationship with the UK citizens. A lot of our people are having families there or work there, and vice versa. So everyone's life is just being put on hold. And at that stage, when this was made known to the world, we had already been seeing these cases for a week. And that's why we decided from the Medical Association to speak out and to say, hey, wait, what we are seeing, yes, we don't know what's going to happen, but for now, we are seeing mild cases. And as well, at that stage, we didn't see that many cases. And up until today, this morning, today I have already saw 4 positive cases, mild. I confer again with my colleagues at primary healthcare level. I'm not talking about hospitals. Each and every one of them confirm what I'm saying. So it's not only me, it is what we see in Pretoria. And remember, Pretoria is the epicenter of this.
Yeah.
So,
So I'll come to the cases in a moment, but when this travel ban was slammed on your country, and you were the doctor who introduced Omicron to the world, what would you describe your emotion? You used the word traumatic. Would you say you were hurt, you were angry, or both?
Angry because of the unfairness of all this, and hurt because how can you do it to people? How can politicians just in the blink of an eye decide about other people's life without taking into consideration what's going to happen to families and people who paid for holidays and vacations either in other countries or in our own country? It's not fair.
And also, it's the same response as 2020 in a world where you now have vaccines, you now have therapies, and that's why it's so unfair. I want to ask you now, what is the situation right now? You were telling us before the program started that cases at the top of the week had been doubling, but that doubling pace has somewhat slowed down. You've said so far all the cases you're seeing are mild. Tell us a little bit about the symptoms, because the symptoms don't seem to be typical of the Delta or the Alpha.
Yes. Thank you for that. So we did see doubling of the cases up until Wednesday. Wednesday we had just over 10,000 cases, and yesterday it was over 11,300 cases. Yes, we do have an increase in our hospitalizations. Yesterday there was 137 cases, if I'm not mistaken. But again, we're not sure whether that are Omicron related or Delta related. From the primary healthcare centers so far, we have seen one group, also part of another group of family practitioners. Again, this whole week up until today, only 4 patients being admitted, with 3 this week, from a primary healthcare side. So the patients admitted into the hospitals, we're not sure whether those patients went directly through the public sector hospitals, their casualties, and what their symptoms are. But what we do know is that the majority of them, I actually want to say all of them, but I don't have that stats, but the majority of, let's be safe, are unvaccinated.
That's interesting and significant. So the majority of the patients who are in hospital, let's say in the past week with positive cases, are unvaccinated.
Yeah, those ones that are severely unvaccinated, again, we're not sure whether it's Delta, whether it's Omicron.
Yes.
We're still waiting in the primary healthcare sector. Primary healthcare sector is where you have patients normally, it's your doctors, your normal family doctors where we work, where you see the majority of patients. So we're still waiting to see what's going to happen with the 50 plus unvaccinated with comorbidities, whether they will be more affected than what the others that's been vaccinated. But I want to say that the vaccinated people, regardless their age, regardless their chronic diseases, what they have, they all, what we are seeing in the primary healthcare space, are having mild symptoms. And I'm not going to use medical terms. There's a way that I can explain it in medical terms, and half of the people won't even understand what we're talking. So I normally want to speak to the people out there and the people on the ground. So what is the symptoms of this case? Body aches and pain, a very nice headache, nice means severe headache, tiredness or fatigue, I want to sleep, I do not feel well, I might have a scratchy throat, I might have a light cough. But it's a general feeling, I'm not feeling okay for the past 2 days.
Yeah. And can I ask you, no respiratory breathing problem, no plummeting oxygen levels?
Nope. I'm going to write, we are now taking my data of the patients that we have now seen this last week and a half, and we're going to do a case study, because I've documented, that's how I work I'm an old GP. So I documented my patients very well. And we're going to use that data to show what it is actually happening there. You will see the stats, the oxygen and the pulse and the temperatures, and the weight. That's and blood pressure and all of that we normally do. So interesting enough, I need to say this, when we saw the Delta patients, they really, they will come in the first 2 or 3 days, not feeling too sick, but round about day 7, 8, 9, up until day 10, they then tended to change. The clinical picture got worse. So we're so used to say to people above the age of 50 or people with comorbidities, please come in earlier. I want to follow you up within 5 to 6 days.
Yeah.
And in this case, we haven't seen that. Actually, the patients are telling us, I'm not going to come in, doctor, I'm feeling much better. And
so
that's
you're saying the Delta curve, and of course, as we saw this in India, it started mildly and then it would just swiftly fall around day 7, day 8 with people who couldn't recover. With Omicron, what happens by day 7?
Nothing. They don't want to come back for a follow-up. They're okay. That's, we have we had a nice protocol of medication that we have also prescribed. We have stopped all of that. And very, very...
No steroids? What are you using to treat these patients? What are you using?
Steroids, but not a very high dosage anymore. We have tried to bring down the of the steroids. And then normally, we're telling them what to do at home. We give them good advice around pulse rate and oxygen levels. So it's not that we leave the patients at home, but you advise your patients. We call it conservative measurements. And they seem to be okay, as if they understand. So why do we want them to come to the doctor when they're not feeling well? We want them to be coming in. We need to test, make sure that whether it's Omicron or something else, if it's Omicron, we need to get you at home, isolating. We need to make sure that you are fine and that we can also advise you on what to do, because we learned that from the Delta.
Now, your ground experience is telling you that the symptoms are mild and the vaccinations are offering certainly some protection. Whether it's Delta, Omicron, you can't break it down, but all the vaccinated patients are doing well after the first 2-3 days. Did you find it irresponsible that the Moderna chief basically issued a statement saying that their vaccines would have to be readapted when that data doesn't exist right now and it's based on computer models?
Yeah, you see this. That's the thing. We're so used in the world, and if you go back and you look, we're so looking at the science, and it's so important. The science is so important, but we forget that there's actually a patient out there who is not a scientific patient. It's a normal patient. It's the normal day-to-day patient, and we need to get that experience, the clinical experience at primary healthcare. For too long, what happened is we focused on hospitalization, specialized care, and neglecting the average patient out there. And it's time that we stand up and speak out and say, but this is the experience. We do not dispute that you will get severe disease. You will get people who is extremely sick, but they are the ones that should be in the hospital. But what are the average doctor, the average nurse seeing out there? And this is what we are seeing.
Could I summarize your prognosis of the situation by the following? Vaccinated patients are doing better than unvaccinated patients. So vaccines are definitely still offering some protection. After the first few days, patients are getting better. Unlike the virulence that you sometimes saw with Delta, you're not seeing that virulence so far with Omicron. And the symptoms are not showing respiratory disorder or plummeting oxygen levels. Have you seen any mortality that is Omicron linked in your country?
In our country, yeah. Well, we don't know. I haven't seen. So we do get the death reports every day, but it's very low numbers. But it's not telling us whether it is related to COVID themselves, whether it's Delta or Omicron, or whether it is patients that's already been admitted for quite some time in the hospitals, lying there. Some patients can lie for 2 months in the hospital. So we don't have
Sure.
that data.
No, but what is the difference you're seeing between Delta and Omicron in a day-to-day way?
No loss of smell, no loss of taste, no oxygen depletion levels or low levels, no, or not now, no, very few people with high pulse rates, and they're generally not that sick. So you have to understand that I myself, during the Delta wave, I treated more than 600 patients, and we saw them. We're not one of those doctors telling you over the phone or Zoom
Yeah.
media or whatever. We physically
Yeah.
examine you. So that also gave us a lot of experience, and that's why it was so easy for me to say, there's something else here coming on. It's not the same.
And guess what? Now that it's clear that in so many parts of the world, Omicron has been detected not linked to any travel, we don't even know, that this tendency to say it originated in South Africa, even if it did, it makes the responses wrong and racist almost. But we don't even know that now. It could have originated anywhere in the world. You, ma'am, just found it first. And, do you feel that South Africa is at the receiving end of panic, or would you call it apartheid of a kind of modern day racism?
I think so. From the rest of the world, I think we need to relook. I'm very happy to see that the WHO said that we need to relook at how you report and the significance of the consequences of that. And I fully agree that we need to look different at this, because going forward, most countries would be reluctant. The scientists would first wait and keep it under the blanket until they sorted out what's going to happen. And it should not be like that. So South Africa did what was the right thing. I always say it is the ethical obligation of the scientists to say, we have seen something, we don't know what it means. And that should be there. But if you do what you are doing and you slam them, or the country that reports on them, you will never get to the bottom of anything. And again, I've said it right from the beginning, especially when that lockdown restrictions came into from other countries to South Africa. I've said to them, you are already seeing it, you just don't know it.
Yeah. What does South Africa, what is your country, what do you as a doctor need most right now? How should the world be responding?
So what you need to do is you need to stick with the simple measurements of the mask, distancing, hand wash, that we call it non-pharmaceutical intervention. You should stick to that. You should stay away from crowds, and then you need to get vaccinated. And if you are vaccinated and your country are offering you boosters, go and get it, because that's what we have seen. I have seen, my oldest patient is 82, a lady with a lot of comorbidities, and she's been vaccinated. And that's my oldest one, and she's fine. I can promise you, she wasn't vaccinated, she would have maybe not be fine. And if it was Delta, she would have been extremely sick.
So you're feeling, what's the word you'd use? Are you feeling cautiously optimistic that Omicron is not going to lead to the devastation that we saw with Delta?
At this stage, cautiously optimistic. It's still early days regarding the hospitalization, so don't get us wrong. But what we see in the primary healthcare space, and that's where it normally, that's the ground level experience. We acknowledge, yes, it's fast spreading. It goes to, families are being affected with this. But the severity at this stage, if we can keep it like this, it doesn't matter then if your numbers increases, as long as it stays mild at family practice level, primary healthcare level, we can all live with that.
A last question to you. How are you coping?
I'm also overwhelming this week with all the press and seeing the patients in between it. It's a madhouse. But, I feel much better. because it's difficult to go out there in the media and say something, and if you're wrong, you will be killed, like yesterday, and that we keep on seeing the same. I keep on asking my other colleagues that is in also family practitioners, are you seeing something different than me do? That we're all on the same page here. So that gives me a bit more confidence to say, yes, this is what we're seeing. I'm not mad. This is what we're seeing.
You're certainly not mad. You have given the world, you have done a service, public service, as you continue to do in your own country. And I'm sorry that so much of the world has responded in an absolutely inappropriate, knee-jerk way. We thank you, Angelique Coetzee, the doctor who first revealed Omicron to the world. It's a pleasure having you on our platform, and we hope to have you back with better news, hopefully soon in a couple of weeks. We'll let you get back to your work. Thank you so much for being with us.
Thank you so much.
Take care.
Enjoy
Take
your
care.
time.
Take care. Take care. Thank you and bye-bye. Bye-bye. It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.